You asked, I'm delivering, so order up. 3 tips for new grad nurses who want to succeed in oncology. Let's go.
Number 1, for God's sake, please do not attempt to learn all the drugs at once. Just don't do it. That list is already super long and it grows longer due to the announcement of new drugs that hit the market every month or so. Now, different drugs and regimens are used in different populations. So instead, focus on learning the ones that you encounter most frequently so to not get overwhelmed. Also, just as a word of encouragement, I'm an oncology nurse with over 8 years of experience, and I still do not know all the drugs. But thankfully, if I don't know a drug, I look it up on either Lexicomp, UpToDate, or ChemoCare, and I encourage you to do the same. 2, get used to disappointment. No, that has nothing to do with you or your skill, and everything to do with the vice grip that insurance companies have on healthcare in this country. Cancer drugs are some of the costliest on the market, especially the newer oral targeted therapies. And in order to gain access to these medications, patients have to have very specific cancers complete with the correct biomarkers. Additionally, they often have to have tried and failed other treatments, as many of these drugs are not used in the first-line setting. If the patient doesn't fit into that very specific category, they may have their medication denied, even after you and your team devote countless hours trying to get it approved, which can be extremely frustrating and disappointing for everyone involved. Number 3, never ever pour from an empty cup. As a new grad, you must find positive ways to support your physical and mental well-being. This can be said for any type of nursing, but it's especially important in an emotionally challenging field like oncology. As nurses, we are expected to give a lot both physically and mentally, and that's just not possible when you're running on empty. To protect my sanity, I practice the disconnect method, where I disconnect from my job the moment I clock out. It helps keep my home a safe space free from work stress where I can focus instead on rejuvenation and recovery, especially after a tough shift. Anyway, if you're a new grad nurse just starting in oncology, welcome. This is a wonderful, deeply fulfilling field that will enrich your life and give you a sense of purpose, and I can't wait for you to experience it for yourself.